Hello everyone, welcome back to my channel. Today I'm going to talk about pulpectomy, a treatment which is used to save the child's tooth when it's badly damaged or infected. Today in this video I'm going to walk you through what happens during the procedure, why it's important, and also I'll be sharing with you some of my patients' x-rays who have undergone this treatment. So what is pulpectomy? Let's break this term into two halves for better understanding. Pulp is basically the innermost layer of the tooth which helps in providing nutrition to the tooth, and ectomy means removal. So this is basically a type of root canal treatment in children. When the child's baby tooth has deep cavity and infection, your dentist is going to advise you this treatment to help clean out the infection and keep the tooth safe until it falls out naturally. Why is pulpectomy needed? So you might be wondering, why do we need to save these baby teeth when they're going to fall out anyway? Well, the baby teeth are super important, and as I've discussed in my previous videos, that they are important in chewing the food properly, speak clearly, and help in guiding the permanent tooth in proper position. Now, if the baby tooth is lost too early, then they might cause problems with how the permanent teeth come in. What are the indications of pulpectomy? Inflammation is spread to the pulp chamber, which is the innermost layer of the tooth. It is indicated by symptoms of irreversible pulpitis, which means the child will have spontaneous pain in the tooth, or the pain of the tooth might increase at night, especially when they are lying down, or when you take an x-ray, you can clearly see the infection spreading in the bone and surrounding tissues, and probably you might also see some degree of bone loss. So that's when the dentist is going to advise you for pulpectomy. So what happens during pulpectomy? Let's break down this procedure into simple steps. Step number 1, numbing the area. The dentist is going to numb the tooth in question and the area surrounding it with the help of local anesthesia so that your child won't feel any pain during the treatment. Step number 2, cleaning the tooth. So the dentist aims in cleaning the tooth from inside to remove the damaged tissue and any bacteria causing infection through their specialized dental instruments, and later on rinse and flush it thoroughly with the help of good quality irrigants. Step number 3, filling the tooth. The dentist is going to dry the tooth and fill the empty space with the specialized material to protect the tooth and stop any future infections. Step number 4, sealing or capping the tooth. The dentist is then going to seal the tooth properly with a good filling material, and on top of it is going to place a cap on the tooth to keep it strong until it's time for the adult tooth to come in. Let me share with you some of my patients' x-rays who have undergone this treatment for better understanding. The patient had deep decay in the milk tooth, so I removed the decay and unsupported tooth structure from the top and measured the length of the roots with my instruments, and cleaned it thoroughly and filled the empty space with the special material and sealed it with a good quality filling material, followed by which I had placed the cap on the tooth for the extra strength. So this procedure might take single or multiple visits depending on the infection and patient's cooperation. Is the procedure safe? Yes, the procedure is totally safe, but some children might still experience a bit of discomfort during and after the procedure in spite of numbing the tooth. But however, this discomfort is usually very mild and can be taken care by the medications. But this treatment will help you to prevent from the bigger pain from the infection later on. And however, your dentist is going to give you some tips on how to take care of the tooth after the procedure. To wrap up, the pulpectomy procedure is a simple and effective way in saving your child's tooth and protecting their dental health. Though it might sound like a big word, but it's just another tool the dentists use to keep the kids' smile happy and healthy. If you have any more questions about this treatment, drop them in the comments below, and don't forget to like, subscribe, and share this video with anyone who might find it helpful. Thanks for watching.